Hello guys, I am Vishnu. So in the previous video that we had shared 2 days back, we talked about an introduction into drug-induced liver disorders, which are the different types of drug-induced liver disorder, like for example, hyperacute, subacute, and acute, and what are the important features that we see in them. And also we explained about what are the very spectacular or very characteristic features that we see in liver disorders and why it happens. Like for example, we discussed about why renal failure occurs, why hepatic encephalopathy occurs, why ascites occur, like that we talked about it. So in this video, we are going to talk about which are the different types of drug-induced liver disorders, what are the causative agents behind this liver disorders. That means the drugs that cause specific liver problems, what are the mechanisms behind it, and what are the symptoms. So let's go into it directly. So you know the mission of our channel. We have been posting approximately 16 to 18 odd videos in the past 1 month. So I hope you have understood our motto is to share practical knowledge, because books are available in front of you. But how you are going to interpret or visualize it practically, that is the question. So this platform will definitely give you detailed insights into things, but at the same time, in a practical perspective, which you can easily remember. So when we talk about drug-induced liver disorders, there are 7 disorders. One is cholestasis, one is steatosis. It is also known as fatty liver. One is hepatitis, one is fibrosis, one is vascular disorders, that means related to the blood vessels. One is hepatocellular necrosis, and the last is hepatic tumors. So we are going to talk about all of these disorders in this video. So first we will go into drug-induced cholestasis. So it is defined as stagnated movement of bile through bile ducts. So if stagnation means, for example, something that is blocking the normal flow, that is called stagnation. That is why in malaria and all, usually people are advised that the drains or nearby, if there is any water body, it should not be left stagnated, especially drains, because that becomes the breeding grounds for mosquito and larva, which can further spread malaria. So if bile does not flow properly through bile ducts, so that becomes stagnated. That condition is known as cholestasis. So it is caused by oral contraceptives. It is caused by carbimazole. Carbimazole is actually an anti-thyroid medication. It is used for hyperthyroidism. Anabolic steroids and cyclosporin. Cyclosporin is actually an immunomodulator. Now, if we come to the mechanism, anabolic steroids or contraceptives, they actually block the excretion of bilirubin from liver cells into the bile. So what happens is, liver cells actually process the bilirubin, and that is excreted into bile, and then the process continues. So steroids and contraceptives, and to some extent rifampin also, they block the excretion of bilirubin from the hepatocytes, that is liver cells, into bile, which can cause cholestasis. And rifampin also causes cholestasis by 2 mechanisms. Number 1 is hyperbilirubinemia. Definitely, if bilirubin level is very high in the body, then it will not process through the bile properly. So that can cause cholestasis, and definitely inhibition of bilirubin excretion from liver cells into bile. This is very, very important to know that in many liver disease patients, we have seen that they experience pruritus. So it is a kind of itching rashes that happen. So there is a reason behind it. When bile is not excreted properly, bile salts enter the bloodstream. So that can lead to pruritus. And definitely the other symptoms are hyperbilirubinemia. Bilirubin level will be high. LFTs, the liver function tests, will be elevated. And there may be symptoms of hepatitis as well. There will be some areas where we will say symptoms of jaundice, symptoms of hepatitis. So we will discuss in detail into that in future videos. So hepatitis symptoms, what are they? Usually it can be yellowish discoloration of skin, sclera, and urine. Then you can have diarrhea as well. You can have anorexia. That means you will not have hunger. So all these things may also happen. Now we come to drug-induced ketosis, which is also known as drug-induced fatty liver. So it is defined as accumulation of fat within hepatocytes or liver. It's also known as fatty liver. It is caused by amiodarone. Amiodarone is actually an antiarrhythmic agent. It is actually a broad spectrum antiarrhythmic agent. It is used in a variety of arrhythmias. Tetracyclines are broad spectrum antibiotics. Valproic acid is a broad spectrum anti-epileptic agent. And methotrexate is an anti-cancer agent, and it's an immunosuppressant also. We can't simply say it is anti-cancer. It is used in autoimmune conditions also. So it is an immunosuppressant as well. If we look at the clinical manifestations of fatty liver, drug-induced, so we can see metabolic acidosis. Now, why metabolic acidosis happens? So the liver actually metabolizes 60% of the lactate in our body. So if the liver is damaged, so there will be increased splanchnic release of lactate. If the liver is damaged, there will be increased splanchnic release of lactate. That can cause lactic acidosis, which can lead to metabolic acidosis. Definitely in kidney disease also, metabolic acidosis is seen. But in liver disease also, it may be observed. The reason behind it is mentioned here. And definitely hypoglycemia occur because the function of the liver is to promote gluconeogenesis and glycogenolysis. So if the liver is damaged, then hypoglycemia may occur. Especially if that person is already on oral hypoglycemic agents or insulin or something, then the risk will be much more. Fatigue can be seen definitely because blood sugar level will be low. You will have symptoms of jaundice, you will have anorexia, so your nutrition content will be very low. So you can have fatigue. Nausea, vomiting is also seen, symptoms of jaundice and hepatic encephalopathy in very serious conditions. Now we come to drug-induced hepatitis. So hepat means liver cells and itis means inflammation. So it is defined as inflammation of liver cells, also known as hepatocytes. The symptoms are similar to hepatitis, which will be discussed in future videos. So we have acute hepatitis and chronic active hepatitis. So acute hepatitis means the symptoms will be very severe, but it will be of short duration. Chronic hepatitis means the symptoms will keep on progressing in due course of time. You won't get a lot of symptoms at one time. And the duration of the disease or the duration of that condition will be long. So the drugs that cause acute hepatitis are dantrolene, isoniazid, and phenytoin. Isoniazid is an anti-tubercular agent, and phenytoin is an agent which is used in epilepsy. Dantrolene, there is a specialty if you are having malignant hyperthermia. I hope you have also heard of neuroleptic malignant syndrome. So it is a condition in which it is actually due to low levels of dopamine. It is a part of extrapyramidal symptom, which is a life-threatening one. In that condition, dantrolene is the drug of choice. Nitrofurantoin, methyl-dopa, and isoniazid can cause chronic active hepatitis. Nitrofurantoin, as you know, it is used in urinary tract infection. Methyl-dopa is actually an antihypertensive. It was initially the first-line choice for hypertension in pregnancy, but now it is the second-line choice. And isoniazid, as you know, it is an anti-tubercular agent. Drug-induced fibrosis. So it is defined as a condition in which there is increased accumulation of scar tissue due to inflammation of hepatocytes. So in simple words, when there is too much of inflammation of hepatocytes, the cells, the liver cells get damaged. And on prolonged damage, they die. And in permanent damage, there is a scar tissue that is formed. So that condition is known as fibrosis. So that is also quite dangerous. It is caused by methotrexate, methyl-dopa, and vitamin A. So vitamin A, if you are overdosing on vitamin A, or if you are having hypervitaminosis, which is related to vitamin A, then it may cause liver fibrosis. So If you look at the pathophysiology, continuous damage to the hepatocytes causes collagen deposition, and this collagen deposition leads to scar formation, and that is called fibrosis. So it is a continuous damage. And scar leads to two consequences. Number one, it is the blockade of blood flow to the liver. And definitely if blood flow to the liver is blocked, the cells will get further damage because they are not receiving nutrition. Blockade of passage of substances from blood to liver, because when blood flow itself is blocked, so the nutritionals or the important substances that the liver should get, that will also get blocked. So further damage will occur. So in this, the clinical manifestations can be fatigue, malaise, abdominal pain, hepatic encephalopathy. Why malaise is seen? Malaise is actually a general sense of being unwell, which is often accompanied by fatigue and lack of interest in activities. It's actually a generalized weakness. That is called malaise. You will not find interest to do anything. You will just feel to take rest all of the time. Fatigue is also seen, and hepatic encephalopathy. Now let's come to the next question. Why abdominal pain in liver disease? So in liver disease, actually hepatomegaly and splenomegaly are observed. So that actually leads to abdominal pain. And the another reason that is we found is in liver disease, fluid accumulation occurs in the abdomen. As I told you in the past video, when there is a liver disease, especially it is a chronic liver disease, there will be portal hypertension. Portal hypertension causes kidney damage, and that leads to accumulation of fluid in the abdomen, which is known as ascites. That can also lead to abdominal pain. Drug-induced vascular disorders. So drug-induced vascular disorders are classified into two. One is called hepatic veno-occlusive disease, and the next is called Budd-Chiari syndrome. Hepatic veno-occlusive disease is actually a non-thrombotic narrowing of small centrilobular veins. So you can understand in this way, hepatic veno-occlusive disease is the non-thrombotic narrowing of small veins, means it involves the small veins, and Budd-Chiari syndrome involves large veins. So hepatic veno-occlusive disease is caused by dacarbazine, azathioprine, and actinomycin. All of these are anti-cancers and immunosuppressants. Budd-Chiari syndrome is caused by cytotoxic agents. It can be chemotherapeutic agents because they are also cytotoxic, and oral contraceptives. The symptoms of hepatic veno-occlusive disease can involve painful hepatomegaly, ascites, jaundice, and hepatic encephalopathy. Budd-Chiari syndrome, the symptoms are same as that of liver disease. Now, many people may get confused like how to remember which symptom in a particular liver disease is different from the others. So most of the symptoms in liver disease are almost the same. So what we can do is some particular conditions will be there where the symptoms are very specific. So for example, in cholestasis, we usually see pruritus. So that is something that is very particular for that. Like that also you can remember. Now we come to drug-induced hepatocellular necrosis. So necrosis, I hope you know very well, it is a condition which is also known as irreversible cell injury. So it is defined as a condition characterized by cytotoxic cellular breakdown or hepatocellular damage. It is caused by paracetamol, propylthiouracil, which is actually a medicine used in hyperthyroidism, salicylates, iron, MDMA is actually an amphetamine derivative, isoniazid, and cocaine. The pathophysiology are same as that of paracetamol poisoning. I'll come into paracetamol poisoning in any future video, then we will connect to that. The clinical manifestations are same as that of liver disease. Now we come to the last topic, and that is drug-induced hepatic tumors. So it is also known as hepatocellular carcinoma. So this is actually usually oriented with liver cirrhosis, hepatitis B or hepatitis C infections. They usually lead to this. But for example, if you are having liver cirrhosis or you are having hepatitis B or C infection, and then if you are under oral contraceptive therapy for a long time or anabolic steroids for a long time, then the condition of hepatocellular carcinoma may get aggravated. So the symptoms include liver cirrhosis symptoms. You will have ascites, etc., etc. Symptoms of hepatitis, weight loss, and anorexia. Weight loss because you will not have a tendency to eat food properly. So that can lead to weight loss. So these are the different types of drug-induced liver disorders. What are the different disorders? What are the causes? What are the symptoms? In the next video, we will talk about how to diagnose different types of liver disorders, drug-induced, and what are the common therapies. Because we don't have a specific agent to treat drug-induced liver disorders. Mostly we focus on symptomatic care. So we will focus on that in the next video that will come tomorrow. Thank you so much for listening. If you find this relevant, then please do share and subscribe. Do share to more people. It may help you in your practical knowledge.